To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, welcome to Your Health. Today we're going to talk about pain management because I'm joined by Dr. Patel from Alleviate Pain and Spine. Welcome back, Doctor.
Thank you for having me back. I appreciate it.
You bet. So July 2025, you opened your first practice here in Northeast Wisconsin. How has it been received?
It's been really well received by the community. We opened our primary two locations in Pere and then in Neenah. From there, to expand that footprint in the community and get easier access for patients and reduce drive times, we have satellite locations in Oshkosh and in Appleton. So it's really easy for patients to come and see us based on where they live.
And I think if somebody's in pain, they want to see it. I'm wondering about accessibility.
Yeah.
Since you've been open, how does somebody like me be able to see somebody like you?
Sure. That was a key point of why we opened Alleviate to begin with, is that patients don't want to wait 2 or 3 months, which is what it takes to see someone in a hospital setting. So to reduce that burden, we brought on a large team so that patients can see us within a week or two's time. From the 3 primary partners that started it, that was Dr. Aman, Dr. Mahmoud, and myself, to our 4th physician partner, Dr. Ibrahim, joined recently, and then our 4 nurse practitioners and APCs that have come in to increase that bandwidth to get patients in that quicker time frame.
Yeah, and it just speaks to the need with the growth of people wanting good solutions. I'm curious, you talked about the hospital system. Do I need to go through those hoops in order to see you? Like, do I need a referral from somebody to see you?
That's a great question, because that defers a lot of patients from seeing providers in general thinking they need a referral. That is definitely not necessary. If you have a primary provider or a specialist that needs to send over for a specific reason, it does help to pinpoint that cause down. But if you just are dealing with any kind of pain throughout your body and you want to have a specialist take a look, we're open doors to see you with no referral requirement.
Yeah, beautiful thing. So a lot of people want to understand what the first visit looked like. When I come in, how am I treated?
Yeah, it's definitely an apprehensive process going to any specialist or provider. We try to make it as seamless as possible. So when a patient comes in, it's more of a detailed history, a communication of what's been going on, where did that pain start, and what was your journey through that process. That'll help us go towards a physical exam to comprehensively look at that site and see what's going on, reviewing of imaging, and putting all those pieces together to formulate a plan of treatment. And that treatment is across the board, from injections to medications to surgery, but we'll decide what's best needed and kind of walk you through so you're comfortable with that plan.
And one thing I know that we've talked about before, as we wrap up, the patient time with doctor is very different.
Correct. Yeah, our goal is to have a provider in the room spending that time to explain things in detail to you, so that way you have an understanding of what's going on and not just medical jargon being thrown at you.
Beautiful. All right, Dr. Patel, thanks so much for joining us today.
Thank you so much.
And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.